Meadowsweet is a herb in the rose family. For centuries it's been used in traditional medicine. It contains many compounds thought to have anti-inflammatory effects in your body, including salicylates and tannins. The meadowsweet, or Filipendula ulmaria, is also known as Queen of the Meadow or Meadworth, and it's a flowering herb native to Europe and parts of Asia. It's abundant in England and Ireland, but it's also found in North America. It grows in damp environments and marshy areas on riverbanks. It features clustered white flowers that have a pleasant sweet aroma, and it's used in medicinal preparations such as teas and extracts. In traditional medicine, it's been used to treat heartburn, stomach ulcers, colds, joint pains, arthritis, and gout. It's also been administered as a diuretic to increase urine output in people with kidney or bladder infections. The herb contains two prominent groups of plant compounds, the tannins, specifically the type of elagitannins, known as rugosins, and flavonoids, including kaempferol and quercetin. These compounds, as well as others found in the meadowsweet, can act as antioxidants. The antioxidants fight cell and tissue damage caused by reactive molecules called free radicals that can contribute to disease. Additionally, these compounds may have anti-inflammatory effects. The meadowsweet also contains small amounts of salicylic acid, the active component in aspirin that reduces pain and inflammation in the body. One of the most studied uses of meadowsweet is its role in reducing inflammation and in treating inflammatory conditions. Test tube and rodent studies have revealed that the herb can inhibit certain steps in the inflammatory process. It can decrease inflammatory blood markers, and it can reduce heightened responses to pain that are associated with inflammation. These properties may explain why it's been used historically as a remedy for conditions like joint pain. There's also speculation that the herb can relieve severe joint pain associated with gout, a form of arthritis that's characterized by a buildup of uric acid in the blood and crystallized uric acid around the joints. For example, one test tube study found that compounds in the meadowsweet can block xanthine oxidase, which is an enzyme involved in the production of uric acid. Some claim that meadowsweet can be used as a topical treatment for skin inflammation, redness, and acne, but no studies support this idea. The belief that the meadowsweet can soothe the inflamed skin or the acne likely stems from its salicylic acid and its tannin content. Salicylic acid is often used on the skin to promote peeling and exfoliation. This may improve the acne, the sun damage, and the brown skin patches known as melasma. The tannins are thought to have astringent properties, meaning they help to remove oil from clogged pores and to cleanse the skin. Furthermore, some people believe the anti-inflammatory and the antioxidant potential of the meadowsweet in the body translates to the skin. For these reasons, several skin creams and serums contain meadowsweet, even though any of the claims that the herb improves the skin health have only been anecdotal and the research in humans is still needed. Newer and older studies suggest that the meadowsweet has antibacterial properties and it may fight certain bacteria, including E. coli, which is often responsible for cases of food poisoning, but more research on this is needed. Research has also found that meadowsweet significantly inhibits the development of tumours in rats who are exposed to cancer-causing agents and processes. The lack of research on meadowsweet in humans makes it difficult to analyse the potential downsides of its use. Tea is most commonly used, but the tinctures are also available. Using meadowsweet in moderate amounts that doesn't exceed the recommended dose on the products seems likely to be safe for healthy adults, but keep in mind there's no specific reports on safety or side effects. If you're taking aspirin, use caution with the herb since it contains salicylic acid, which is the active component in aspirin. And if you have an aspirin allergy or a salicylate sensitivity, avoid meadowsweet altogether. For more information on herbs, supplements, or health conditions, check out my website.